Welcome back to Drug Talk, everybody. In today's video, I want to discuss 3 things that you should be aware of before starting therapy with escitalopram or Lexapro. The first thing that people should be aware of before starting this medication is that there could be an increased risk of suicidal behavior or worsening of depression in pediatric patients and young adults being patients aged 18 to 24, especially in patients who have major depressive disorder. For this reason, monitoring is recommended during the initial stages of therapy and at each dose change. If this was to occur, some patients, with the help of their healthcare team, may decide to change medications or just discontinue the medication altogether. The second thing that patients should be made aware of is that this medication may cause sexual side effects or sexual dysfunction. This is mainly seen in females. In terms of sexual dysfunction, we would typically see a decrease in libido or delayed or absent orgasm. And the third thing you should be aware of before starting this medication is that the main 2 uses for this medication are major depressive disorder or MDD, as well as generalized anxiety disorder. Now, having said that, there are some off-label uses as well, such as obsessive compulsive disorder, social phobia, or panic disorder. And it's important to be aware of this because when someone gets a new medication, they start researching that medication, they may see indications for a medication and think to themselves, wait a second, I don't have panic disorder, or I don't have obsessive compulsive disorder. Why am I using this medication? So I just want to make sure you're aware that this medication can be used for several different indications. All right, everybody, that's all we're going to talk about today with 3 things you should know about escitalopram or Lexapro. Take care.